Did you know that what doctors told you about normal blood pressure for seniors has been completely wrong for decades? I say that as a heart surgeon who spent over 25 years repairing arteries and watching patients follow the exact guidelines they were given, only to come back months later weaker, dizzy, and sometimes worse than before. For years, we were trained to push older adults toward aggressive blood pressure targets without asking the most important question. Does lower always mean safer when you are over 60? Here is what finally forced me to rethink everything. A massive multi-center study followed thousands of seniors whose systolic pressure, which is the top number, was driven below 120. That sounds ideal on paper, but in real life, many of these patients began to experience fainting, falls, kidney stress, memory fog, and dangerous drops in blood flow to the brain. Blood pressure is not just a number. It is the force that keeps oxygen moving to your heart, brain, and muscles. When it is pushed too low in older bodies with stiffened arteries, circulation can actually worsen. What shocked me even more was how different the outcomes were when doctors targeted a more moderate range. Seniors who maintained systolic pressure around the mid-120s to low 130s, with the bottom number in the 70s, showed fewer strokes, better balance, and higher energy. That range kept blood moving strongly without overworking fragile vessels. In this video, we will reveal the 5 ways you can start using literally right now while you are watching this video to bring your blood pressure down naturally and safely. Then uncover the optimal blood pressure range that actually protects seniors. And stay with me because the number 2 way was discovered in a clinical trial where older adults lowered pressure without increasing medication and regained mental clarity at the same time. Just a quick note before we start. All of the studies and medical sources we used are linked in the description. Before we dive in, here's a quick question. Where in the world are you watching from today? We are opening every comment and replying like a virtual clinic for this community. Now, without any further ado, let's move straight into number 5, because this first step feels almost too simple, yet it immediately lowers pressure inside your arteries in a way most people have never been shown. Number 5. Stop restricting salt and start balancing your minerals today. The 5th most effective way to optimize your blood pressure as a senior completely contradicts everything your doctor probably told you about salt, because cutting sodium too drastically after age 60 can actually trigger dangerous blood pressure instability. Recent research from the European Heart Journal studied over 10,000 seniors and found that those who consumed moderate amounts of salt, specifically between 2,300 and 3,000 milligrams per day, had significantly better cardiovascular outcomes and fewer hospitalizations than those who restricted their intake below 1,500 milligrams. The breakthrough discovery is that your aging kidneys handle sodium completely differently than younger kidneys, requiring a delicate balance between sodium, potassium, magnesium, and calcium to maintain stable blood pressure throughout the day. When seniors drastically cut salt, their bodies can't maintain proper fluid balance, leading to orthostatic hypertension, which is that dizzy feeling when you stand up that causes thousands of devastating falls every year. The key isn't eliminating salt, but rather using the right type and timing it correctly with other minerals in what scientists now call the mineral matrix approach that works with your body's natural rhythms instead of against them. Start your morning with a 1/4 teaspoon of high-quality sea salt or Himalayan pink salt dissolved in warm water with lemon, which helps your adrenal glands produce the correct amount of aldosterone, the hormone that regulates blood pressure throughout the day. This morning salt water, consumed on an empty stomach, actually helps your body maintain lower blood pressure readings for the next 12 hours by preventing the sodium crashes that trigger compensatory blood pressure spikes. For every 500 milligrams of sodium you consume, pair it with about 1,000 milligrams of potassium from foods like bananas, sweet potatoes, spinach, or avocados, creating a ratio that allows your blood vessels to relax properly. The timing matters enormously. Consume most of your salt during daylight hours when cortisol levels are naturally higher and your body can process sodium efficiently. Then reduce salt intake after 6 p.m. to prevent nighttime fluid retention and morning blood pressure spikes. Include magnesium-rich foods like pumpkin seeds, dark chocolate, and almonds with your salty meals, as magnesium acts like nature's calcium channel blocker, helping your blood vessels stay flexible and responsive. Don't fear naturally salty foods like olives, pickled vegetables, aged cheeses, or even good quality bacon in moderation. These whole foods contain cofactors that help your body process sodium properly, unlike the isolated sodium in processed foods. Monitor your response by checking how you feel when standing up from a seated position and noting any swelling in your ankles. If you feel lightheaded when standing, you need more salt, but if your ankles swell, you need more potassium and water. While minerals create the foundation, the fourth method actually retrains your nervous system to control blood pressure automatically. Before we roll on, hit like and make sure you're subscribed. The next part might surprise you. Number 4. Reset your blood pressure in 6 minutes using this Japanese breathing secret. The fourth way to naturally optimize blood pressure involves a specific breathing technique that Japanese researchers discovered can lower systolic blood pressure by up to 15 points in just 4 weeks, outperforming some medications without any side effects. This isn't random deep breathing, but a precise protocol called resonance breathing that occurs at exactly 5 breaths per minute, triggering a phenomenon where your heart rate variability synchronizes with your breathing in a way that resets your blood pressure regulation system. When you breathe at this specific rate, inhaling for 6 seconds and exhaling for 6 seconds, your baroreceptors, which are the pressure sensors in your carotid arteries and aortic arch, literally recalibrate their baseline settings to a lower, healthier level. The Veterans Administration tested this protocol on over 2,000 older veterans with resistant hypertension, finding that those who practiced twice daily for just 3 minutes each session had average blood pressure reductions of 14 points systolic and 8 points diastolic after 8 weeks. What makes this particularly powerful for seniors is that aging naturally reduces baroreceptor sensitivity, which is one of the main reasons blood pressure increases with age. But this breathing protocol actually reverses this decline, essentially rejuvenating this critical blood pressure control mechanism. To perform the protocol correctly, sit comfortably with both feet flat on the floor, hands resting on your thighs, and breathe in through your nose while mentally counting 1001, 1002, up to 1006, then exhale through pursed lips for the same count. The pursed lip exhalation is critical because it creates slight back pressure that stimulates the vagus nerve, your body's main parasympathetic nerve that directly lowers heart rate and blood pressure. Practice this for 3 minutes immediately upon waking when cortisol and blood pressure naturally spike, and again 3 minutes before bed to prevent nocturnal hypertension that damages organs while you sleep. The key to success is maintaining the exact 5 breaths per minute rate. Breathing faster doesn't work because it activates the sympathetic nervous system, and breathing slower can cause air hunger in seniors with reduced lung capacity. You'll know it's working when you feel a warm tingling sensation in your hands and feet during practice, indicating improved peripheral blood circulation, and many seniors report that their chronic cold hands and feet completely resolve after a few weeks. Use a free smartphone app like Breathe Plus, or simply watch a clock with a second hand, and never force the breath or hold it, as this can temporarily spike blood pressure. The breathing should feel natural and comfortable. The optimal times to practice align with your body's natural blood pressure peaks, typically between 6 to 8 a.m. and 4 to 6 p.m., helping to blunt these spikes and create more stable readings throughout the day. Breathing resets your pressure sensors, but the third method ensures your blood maintains the perfect consistency for optimal flow. Number 3. Drink water at these exact times to drop your blood pressure 12 points. The third most powerful method for achieving optimal blood pressure revolutionizes how seniors should approach water consumption, because researchers at UC San Diego discovered that when you drink, water matters more than how much you drink. Most seniors are walking around with blood that's too thick without even knowing it, because the sensation of thirst decreases by up to 40% after age 60. And this subclinical dehydration forces the heart to work harder to pump thicker blood through narrowing arteries. The breakthrough study showed that drinking exactly 16 ounces of room temperature water precisely 30 minutes before each meal can lower systolic blood pressure by an average of 12 points within just 2 weeks, but drinking the same amount with meals or randomly throughout the day provided almost no blood pressure benefit. Your blood plasma is normally about 92% water, but in dehydrated seniors it often drops to 88%, and that seemingly small 4% difference increases blood viscosity enough to raise blood pressure by 15 to 20 points while also increasing stroke risk. The mechanism works through something called pre-meal hydration priming, where water consumed 30 minutes before eating triggers the release of specific hormones that help your body manage the sodium and fluid shifts that occur during digestion. Start your targeted hydration protocol by drinking 16 ounces of room temperature water immediately upon waking, before even sitting up in bed if possible, as this reverses the 10% blood volume reduction that occurs during sleep and prevents the morning blood pressure surge. Room temperature is crucial because cold water causes temporary blood vessel constriction that can spike blood pressure for up to 30 minutes, while water that's too warm can cause vasodilation and dangerous blood pressure drops in seniors. Add a quarter teaspoon of Celtic sea salt or a pinch of cream of tartar. For potassium, to your morning water if you experience dizziness when standing, as this helps your body retain the fluid in your blood vessels where it's needed rather than immediately filtering it out through your kidneys. 30 minutes before lunch and dinner, drink another 16 ounces of room temperature water, setting a timer if necessary because this timing allows the water to be absorbed into your bloodstream before food arrives, optimizing both digestion and blood pressure. Between meals, limit yourself to small 4-ounce sips every hour to maintain hydration without triggering excessive urination, which is especially important for seniors who already deal with frequent bathroom trips that can disturb sleep and increase fall risk. The type of water matters significantly. Filtered water that retains natural minerals works best, while distilled or reverse osmosis water can actually worsen blood pressure by depleting essential minerals from your tissues. Monitor your hydration success, not just by urine color, which should be pale yellow like lemonade, but also by pinching the skin on the back of your hand. It should snap back immediately, not remain tinted, which indicates cellular dehydration that affects blood pressure. Proper hydration prepares your cardiovascular system, but the second method actually rebuilds and strengthens your blood vessels from the inside. Number 2. Do this 9-minute chair exercise that beats hours of cardio. The second most effective way to optimize blood pressure involves a revolutionary type of exercise that sounds almost unbelievable. You can do it sitting down. It takes only 9 minutes 3 times per week, and research shows it works better than hours of cardio for lowering blood pressure in seniors. Isometric resistance training means contracting your muscles without moving your joints, like pushing against an immovable wall. And this unique type of exercise triggers profound changes in your blood vessels that last for up to 22 hours after each session. The Mayo Clinic's landmark study on adults over 65 found that those who performed specific isometric exercises had average blood pressure reductions of 14 points systolic and 8 points diastolic after just 8 weeks, dramatically outperforming both walking groups and traditional weight training groups. The magic happens because during an isometric hold, blood flow to the contracting muscles gets temporarily restricted, and when you release after exactly 2 minutes, the sudden rush of returning blood triggers a massive release of nitric oxide, your body's most powerful natural blood vessel dilator. This post-exercise response is so powerful that researchers call it exercise-induced hypertension. And unlike cardio, where blood pressure returns to baseline within an hour, isometric training keeps blood pressure lowered for nearly a full day. The scientifically proven protocol involves 3 specific exercises: the wall sit, the modified plank, and the hand grip squeeze. Each held for 2 minutes with 3 minutes of rest between exercises, performed 3 times weekly. For the wall sit, stand with your back against a wall and slide down until your thighs are parallel to the floor, or as low as comfortable for your knees, breathing normally throughout the hold. And if 2 minutes feels impossible initially, start with 30 seconds and add 15 seconds each week. The key is maintaining steady breathing because many people unconsciously hold their breath during isometric exercises, which can dangerously spike blood pressure. Count out loud if necessary to ensure continuous breathing. The modified plank for seniors involves resting on your forearms and knees rather than toes, maintaining a straight line from head to knees while engaging your core, which not only lowers blood pressure, but also strengthens the deep stabilizer muscles that prevent falls. For the hand grip exercise, use a tennis ball or specialized hand gripper, squeezing at about 30% of your maximum strength. It should feel like moderate effort, not straining, and this particular exercise has shown remarkable results because grip strength directly correlates with cardiovascular health and longevity. Perform these exercises on Monday, Wednesday, and Friday mornings when testosterone and growth hormone levels peak, maximizing the blood vessel remodeling effects that make this training so effective. What makes isometric training perfect for seniors is that it strengthens muscles and bones without stressing joints, improves balance and stability, and provides superior blood pressure reduction with just 27 minutes of total exercise per week. Now prepare yourself for the #1 method that left researchers stunned and revolutionized everything we thought we knew about senior health. Number 1. Use this Finnish cold water trick that adds 6 years to your life. The most powerful method for optimizing blood pressure in seniors comes from a 20-year study in Finland that followed 3,500 older adults and discovered something that completely shattered conventional medical wisdom. Those who practiced regular cold exposure had 50% lower rates of hypertension, 40% fewer cardiovascular events, and lived an average of 6 years longer than those who avoided cold. Therapeutic cold exposure works through multiple mechanisms, but the primary one is called cold-induced vascular training, where controlled cold exposure causes your blood vessels to rapidly constrict and then powerfully dilate, essentially giving them a workout that maintains their flexibility and responsiveness despite aging. When Johns Hopkins researchers had seniors immerse just their hands and feet in 50-degree Fahrenheit water for 10 minutes daily, their blood pressure dropped by an average of 18 points systolic and 10 points diastolic within 6 weeks, exceeding the effects of most blood pressure medications. But here's what's truly remarkable. Cold exposure doesn't just lower blood pressure temporarily. It actually triggers the growth of new mitochondria in your blood vessel walls, improving their ability to produce nitric oxide and maintain healthy pressure long-term. The protocol that works best for seniors doesn't involve dangerous ice baths or shocking cold showers, but rather a graduated approach that starts with the extremities and slowly builds cold tolerance over several weeks. Begin by filling a basin with cool tap water around 65 degrees Fahrenheit and immersing your hands up to the wrist for just 30 seconds, twice daily, focusing on slow, deep breathing to prevent the stress response that can temporarily raise blood pressure. Every 3 days, lower the water temperature by 2 degrees until you reach 50 degrees Fahrenheit, which research shows is the optimal temperature for triggering beneficial adaptations without causing dangerous stress responses in seniors. After 2 weeks of hand immersion, add foot soaking in the same temperature water for 1 minute while seated safely with non-slip mats, as the feet contain specialized cold receptors that trigger particularly powerful cardiovascular adaptations. The critical discovery that shocked researchers is that cold exposure stimulates the production of brown adipose tissue, a special type of fat that burns calories to create heat, and seniors with more brown fat have significantly better blood pressure control, improved insulin sensitivity, and reduced inflammation throughout their bodies. Once comfortable with extremity exposure, progress to ending your warm shower with 30 seconds of cool water over just your legs and arms, never shocking your chest or head suddenly, which could cause dangerous blood pressure spikes or cardiac arrhythmias in seniors. Time your cold exposure between 3 p.m. and 6 p.m. when body temperature naturally peaks and cold tolerance is highest, as this maximizes the blood pressure lowering effects that extend through the evening and night when most heart attacks and strokes occur. The cold also triggers a surge of norepinephrine, a hormone that not only helps regulate blood pressure, but also improves mood, sharpens cognitive function, increases energy, and even helps preserve muscle mass, addressing multiple aspects of healthy aging simultaneously. Many seniors report that after just 2 weeks, they need fewer blankets at night, feel more alert during the day, sleep more deeply, and most remarkably, see consistent blood pressure improvements that astonish their doctors. The optimal blood pressure truth for seniors. Now that you understand the 5 most powerful methods to naturally control your blood pressure, it's time to reveal the shocking truth about what your blood pressure should actually be after age 60. The optimal blood pressure range for seniors is 130 to 139 systolic over 70 to 79 diastolic, not the 120 over 80 that's been drilled into our heads for decades. This senior sweet spot, as leading cardiologists now call it, represents a fundamental shift in medical understanding based on multiple large-scale studies involving over 100,000 older adults worldwide. The SP Senior Trial, which followed 9,361 adults over 75, found that those who maintained blood pressure in this slightly higher range had significantly fewer falls, better cognitive function, and surprisingly, fewer cardiovascular events than those pushed to achieve lower numbers. The reason is fascinatingly simple, yet was overlooked for decades. As we age, our blood vessels naturally become less elastic. Our brains require more pressure to maintain adequate perfusion, and our kidneys need higher pressure to filter properly. When doctors aggressively lower blood pressure in seniors to young adult levels, they're literally starving the brain and organs of adequate blood flow, leading to confusion, dizziness, falls, and accelerated cognitive decline. The 130 to 139 systolic range provides enough pressure to push blood through less elastic arteries and reach all organs effectively, while the 70 to 79 diastolic range ensures adequate perfusion during the heart's relaxation phase without causing excessive strain. This is why so many seniors who achieve perfect blood pressure of 120/80 feel terrible, tired, dizzy, confused, and weak, because their bodies are essentially running on insufficient fuel pressure. Studies from Japan, where people live longer than anywhere else, confirm that seniors with blood pressure in the 130 to 139 range have the best outcomes, including lower dementia risk, fewer fractures from falls, and better quality of life scores. The key is maintaining stability within this range rather than having blood pressure that swings wildly from too high to too low, which is why the 5 methods I've shared are so critical. They create stable, consistent pressure rather than the roller coaster that medications often cause. Remember, if your blood pressure is slightly above 140, that's not a medical emergency requiring immediate medication. It's an opportunity to implement these natural methods and gradually bring it into the optimal range without the risks of overtreatment. Your journey to optimal blood pressure doesn't require a medicine cabinet full of pills or extreme lifestyle changes. These 5 proven methods work synergistically to achieve and maintain that perfect 130 to 139 over 70 to 79 range that science shows is ideal for thriving in your senior years. Start with just one method this week, add another every few days, and within 2 months, you'll have built a comprehensive blood pressure management system that works better than medications alone while actually improving rather than compromising your quality of life. If this video opened your eyes to the truth about senior blood pressure, please hit that subscribe button so you don't miss our next breakthrough video about the 5 foods that doctors secretly eat to prevent heart disease after 60. Thank you for watching, and remember, your best health years can still be ahead of you.